Since the first cases of AIDS were identified in 1983, we've come a long way. Today, we have the tools to end the HIV epidemic. So what will it take to end AIDS? Well, we know nowadays that if we identify all those that are infected, we get them into therapy, we get them to take their medications and get their virus suppressed. That is not only good for them, but it's also good for society because transmission from HIV essentially stops. We also need to identify all those individuals who are at risk of developing HIV, who are acquiring HIV but have not yet been infected. And those individuals can be put on something called PrEP, or pre-exposure prophylaxis. In other words, you can give them an antiviral medication that will prevent them from catching HIV. Those two things, treatment as prevention and PrEP, are critical in stopping the HIV epidemic. So is that simple? What will it take really to stop the HIV epidemic? Well, first and foremost, in order to do these two things, getting more people on therapy and implementing PrEP, additional resources are needed. At a time where global economies are not doing well and competing public health problems exist demanding resources be allocated, we will need to find ways to find more resources to dedicate to get people on therapy for HIV. The second challenge is obviously combating stigma and discrimination. Throughout the epidemic, stigma and discrimination has been a major barrier for people to get tested, for people to enter care, for people to remain in care. And therefore, we need to continue addressing stigma and discrimination. Finally, we're going to have to make better healthcare systems. We need to retool and reinvent better ways to deliver care. Today, when somebody gets infected with HIV, they need to get into care, and they need to remain in care for the rest of their lives getting antiretroviral therapy. We know that this component, retention in care, keeping people engaged in care throughout their long haul, is really a major challenge. And even here in the United States, over 50% of people diagnosed who initially enter care are not retaining care. And therefore, finding healthcare systems, developing healthcare systems that do better in developing and keeping people in care and retaining people in care is going to be a priority. Finally, in order to really end the HIV epidemic, we're going to have to continue doing research. And that research is going to have to focus on finding a cure and finding a vaccine. For the over 33 million people who are living with HIV around the world and who will need to be on therapy for the rest of their lives, we need to find a way to actually be able to stop therapy. And for that, we're going to have to find a way to cure them. The second is finding a vaccine. In this day and age, close to 2 million people every year are newly infected with HIV. In order to prevent those 2 million new infections, we're going to have to find a vaccine that prevents people from getting HIV. The same way we found a vaccine to eradicate smallpox or to almost get rid of polio in this day and age. So again, a cure and a vaccine are critical priorities on HIV research. And finally, as a society, we need to all get together and find ways to address HIV in our communities. Our challenge should be that by the end of this decade, HIV should no longer be a major problem in most of our communities. We can do it if we will work together to achieve it.